Hi, I'm Shane Phillips, CEO of the Phillips Group, and I'm here with Hesham Ismail, the Chief Human Resource Officer and Deputy CEO of the Makkah Healthcare Cluster for the Ministry of Health. Welcome.
Thank you, Phillips.
It's great to have you here at the largest HR conference in the Middle East. And I understand that Saudi Arabia was ranked in one of the top 3 countries in the way it handled the COVID crisis. And of course, you're in that ministry. What were some of the things you did from an HR perspective to stay ahead of the game?
Well, thanks to Phillips. I'm really happy to be back after 2 years again to the summit. It's been a quite interesting and challenging journey. But if I want to summarize it, I think the pandemic has accelerated the transformation objectives. And by saying that, we know that transformations, development, the vision is all depending on the people capabilities. One of the main ideas of the transformation was the utilization of resources. So in the Ministry of Health, I'm talking about Makkah Healthcare region, we have 10 hospitals. And before the transformation, before COVID, these hospitals used to work in isolation with one another. So if you are a physician or a nurse or an employee working in A hospital, and there is a shortage in a B hospital, then the system does not allow, or the mindset was not there, so utilize this shift of the resources. So what we did by going ahead of the pandemic is we started immediately to build a system that ease the mobility of the workforce around the 10 facilities. So as an example, we put one of the criteria, which was the occupancy rate. So the hospital who has the lowest occupancy rate will be the top in priority to send employees or workers to the hospital with the highest occupancy rate. This is one. But really the major factor was focusing on the well-being of employees by forming a lot of initiatives that make the employees more confident, more safe, psychologically in the first place, but also thinking of their families. As being in a frontliner, the demand and the workload has increased in the healthcare. So this is putting a more burden on the workers and employee in Makkah Healthcare Cluster. So we try to find ways that would really help and support their day-to-day requirement, going even to their groceries, by buying their groceries, by signing a lot of agreements with the big supermarkets to open 24/7, allocated some of their branches to be only opened for the healthcare workers in Makkah Healthcare Clusters. And this has really paid a lot and put us in ahead, not only in managing the pandemic, but also in achieving a high milestones in the transformation itself.
Well, thank you so much. Good to see you again at the conference, and thanks for being part of HRTV.
Thank you. It's always a pleasure. Thank you.
This is HRTV. We're at the HR Summit and Expo in Dubai, and look forward to our next video because it's coming right up.